Alright, so for my speech, I am here to inform y'all about the concussions on young athletes. It is very common to our society today. What is a concussion? A concussion is a serious brain injury that is caused by the force of an object or anything that hits the side of your brain, or the side of your head, my bad. In your brain, it'll move back and forth against your head, which will cause a minor or serious concussion. In the world full of young athletes, concussions are very rare, very serious, and do tend to happen a lot, especially during football games or any hockey games. When I used to play volleyball, I witnessed a concussion myself. One of my teammates, she dove for the ball and she, hit her head on the floor. We thought she was just holding onto her head, but then after a few seconds, she ended up having a small seizure and she was rushed to the hospital. And after that, we did find out that she did have a concussion. It wasn't serious, but it was pretty minor. But concussions, again, are very serious in the hockey field and football field because they run into each other, so it can be very bad or it can be very minor. Concussions result in many symptoms that can be for a short-term period or a long-term period. There can be a risk of memory loss, which they would wake up from in the hospital asking so many questions. How did this happen? Where am I at? The reason they would lose memory is because if the injury is hit on the side of your two ears, approximately close to your ears on each side, then that's where the temporal lobe is, and that is where all your memory is stored. So if it hits one of there, your memory will most likely be lost. Concussions can mess with emotions, meaning it can make them aggressive, can make them very angry, very vulgar. These do affect the brain as well, causing, again, mood change. Meaning aggressive, it does make them want to hurt people, but sometimes it does not. There can be some outcomes from the incident. There are positive and then there are negative outcomes, but most likely they are positive in the end. A question that parents always ask the doctor when their young athlete is in the hospital is when they are, what can we do to help them regain their strength back? So in order to help get their strength back, there are many therapy sessions. Doctors do prescribe medication to help them. Bed rest is the number one common thing to help them regain their strength, as well as friends, family, coaches, and teammates along by them to help them regain their recovery. If a athlete does get a minor concussion, it can take up to about 7 to 10 days to recover, but if it is a serious concussion, meaning a grade A or grade 4 concussion, it could take about a few weeks, meaning maybe to about months for a full recovery. And the end conclusions are very serious when it comes to young athletes. Memories go away. They don't remember that championship. They don't remember being on the field with their team or anything like that. There are positive outcomes from the recovery of the concussion. Again, positive results and things like that. Go back to the page here. There are possible outcomes for their incident is just walking, getting that memorization back from teammates, from family, coaches, being able to remember what was going on before everything that happened. Something that can come from, an outcome that can come from the athlete from the concussion is depression. About 50% does affect athletes. It does set back from recovery. Again, the concussion is very serious in the world today. Young athletes in this world are very known for experiencing concussions, incidents, and don't know how to handle it. But it was very traumatic for me when I did experience that day when my teammate did get a concussion. All of us that were by her side as her teammates didn't know what to do and how to feel, how to react, or anything like that. It was very scary to watch something like that to a person at a young age, and it was very scary. But the result in these systems are likely for a short-term result due to, again, proper treatment. They want to get bed rest, they want to stay hydrated, they want to make memories, they want to keep those memories, but concussions do tend to be a short-term effect. It is rare today that concussions are happening to young athletes, but they are being protected, especially in football, by helmets, and again, hockey, helmets as well. Again, in our society, concussions are very common. So it is very grateful that we do have helmets to protect our heads and prevent any injury for the athlete.